I think a solutions-oriented lens is really helpful for health reporters because inherently health is a field where people are looking for new ideas. They are looking for better ways to help serve individuals and help serve communities. And it's a field where people who are actually working in it, from doctors to nurses to epidemiologists, they're constantly looking for ways that the people maybe across the country, across the world, are trying new things, new treatments, new interventions to get their communities to live longer, healthier lives. So there's lots of ways that people can bring a solutions-oriented lens to the health field. It's a field where there is lots of data available, from scientific literature to talking directly to people at clinics to talking to patients. And often what I found is that a lot of reporters will go and veer towards the negative stories, really looking at what are the most egregious deaths that have occurred, or where have there been insane amounts of spending on really routine procedures. And those are very important stories to tell. I think it's just as important, and maybe even more informative to the health field, to talk about the positive deviance. Who has figured out a way to spend very little money to solve a very complex health problem in a really unique way that maybe might have implications or lessons to tell other clinics around the country or around the world. Those stories can be both really just as interesting as the ones about the egregious deaths or egregious uses of money, but also have a teachable lesson for others to use. The other really interesting thing about the health field is that it is very people-oriented. It is, in the end, all about people. You're talking about doctors, you're talking about nurses, you're talking about whole communities, you're talking about families who are affected by someone's by someone undergoing some disease and trying some new treatment. So as such, I think that there's really an imperative to look for great characters and look for really good, interesting stories to tell. One example of that is in my publication, The Development Set, which looks to tell really interesting experimental stories about health, including involving first-person perspectives where possible.